मैं डॉक्टर ऐश्वर्या पंड्या, फर्टिलिटी कंसल्टेंट एट ओएसिस फर्टिलिटी वडोदरा आपका स्वागत करती हूँ आज के नए हमारे फेसबुक लाइव सेशन में। आज का हमारा टॉपिक इज डूज एंड डोंट्स ऑफ आईवीएफ। जैसा कि आप सब जानते हैं कि आजकल आईवीएफ कराने की जरूरत ज्यादा पड़ रही है लोगों को। There are a lot of people who need to undergo any kind of assisted reproductive techniques in order to become pregnant. तो आजकल ज्यादा से ज्यादा लोग को जरूरत पड़ रही है टू कंसल्ट अ फर्टिलिटी कंसल्टेंट बिफोर दे कैन प्लान अ प्रेगनेंसी, and approximately 3 lakh couples in India undergo IVF in 1 year, and this number is going to increase to almost 5 to 6 lakh couples per year in 2030. So we can see that कि एक इंक्रीजिंग ट्रेंड में ये चल रहा है कि ज्यादा से ज्यादा लोगों को जरूरत पड़ रही है फॉर आईवीएफ। सो जब इतने सारे कपल्स आईवीएफ करा रहे हैं तो बहुत ही कॉमन क्वेश्चन होता है सब पेशेंट्स का कि हम क्या करें या क्या ना करें जिससे हमारे आईवीएफ में हमें सक्सेस मिलने के चांसेस बढ़ जाएं। सो ये बहुत ही कॉमन क्वेश्चन है जो सब पेशेंट्स हमसे पूछते हैं। आज हमारे ये सेशन में हम इस बारे में बात करेंगे। ये जो डूज एंड डोंट्स हैं उनको हमने 3 पार्ट्स में डिवाइड किया है। द फर्स्ट इज आईवीएफ साइकिल से पहले, ड्यूरिंग द आईवीएफ साइकिल, एंड एक बार एम्ब्रियो ट्रांसफर हो जाए उसके बाद क्या क्या ध्यान रखना है। अगर हम सबसे पहले प्री साइकिल की बात करें यानी आईवीएफ साइकिल शुरू होने से पहले क्या क्या चीजें हमें ध्यान रखनी है, तो सबसे पहले स्टेइंग हेल्दी is the first and the foremost point, which includes a lot of things. So we'll see one by one what staying healthy includes. So first is having a balanced and a healthy diet, which includes everything like fruits, nuts, leafy vegetables, and dairy products. And cut down on maida, processed food, bakery items, and sugars. So ये सब आपको avoid करना है और फ्रूट्स, नट्स, ग्रीन लीफी वेजिटेबल्स एंड डेयरी प्रोडक्ट्स को अपनी डाइट में इनकॉर्पोरेट करना है। सेकेंड थिंग इज एम एंड रीच अ हेल्दी वेट। सो BMI इज बॉडी मास इंडेक्स, दैट इज योर वेट एज पर योर हाइट। आपका BMI लेस देन 30 होना चाहिए। काफी सारी स्टडीज ने ऐसा प्रूव किया है कि जब BMI मोर देन 30 होता है तो वो IVF रिजल्ट्स को नेगेटिवली इम्पैक्ट करता है। थर्ड पॉइंट इज एक्सरसाइज रेगुलरली बट मॉडरेटली, यानी हमें कुछ ना कुछ एटलीस्ट 30 मिनट्स ऑफ एक्सरसाइज डेली हमें ट्राई करना है, विच इंक्लूड्स ब्रिस्क वॉकिंग, साइकिलिंग, स्विमिंग, anything which you like. It might not be rigorous exercise, you may not join a gym, but try to do something at least in a day for 30 minutes, which will help you a lot in improving your fertility outcomes. Fourth is कि you need to consult your fertility doctor regarding taking necessary vitamin supplements and medications before starting with the IVF cycle. Before starting with the IVF या जो भी women अभी try कर रहे हैं pregnancy के लिए, उनको हम folic acid supplementation देते हैं। फॉलिक एसिड सप्लीमेंटेशन इज वेरी इंपॉर्टेंट क्योंकि उससे हम प्रिवेंट कर रहे हैं कि बच्चे को कोई न्यूरल ट्यूब यानी कि स्पाइन में कोई डिसऑर्डर्स या डिफॉर्मिटीज ना हो। सो फॉलिक एसिड इज वेरी इंपॉर्टेंट अलोंग विद दैट विटामिन B12, क्योंकि ज्यादातर हमारे कंट्री में ज्यादातर लोग वेजिटेरियन खाना खाते हैं और विटामिन B12 की कमी काफी लोगों में होती है बिकॉज ऑफ वेजिटेरियन डाइट। So vitamin B12 supplementation is important, vitamin D3 supplementation is important. So for all that you need to consult your doctor and start with all the vitamins so that before we actually start with the IVF cycle, your body is very well prepared for it. Next is do not smoke. So if you are smoking in any amount, you need to stop it immediately before you are planning your pregnancy. This applies to your husbands also because smoking has very bad effect on the sperm health. So it is extremely necessary that both of you should stop smoking completely before planning your pregnancy. Next is avoid alcohol or try to keep alcohol in to bare minimum. So the best is to avoid alcohol. If you cannot avoid it, you need to reduce it, so that your overall health is maintained and there are no negative impacts on your oocyte and sperm health because of alcohol. Next is avoid taking any stress and meditate regularly. So stress has a very bad impact on your health in a way that it affects your hormonal levels, and it will indirectly affect your oocyte health and sperm health also. So आज के ज़माने में बहुत common है, everyone is going through some or the other stress, but you need to make this a priority over other things, and you need to take care कि आप unnecessary stress ना लो. Try to stay positive, speak positive things and think positive things when you are undergoing this treatment. बहुत इजी है नेगेटिव हो जाना या नेगेटिव बातें सोचना, बट यू हैव टू बी प्रोएक्टिव एंड टेक अ स्टेप कि नहीं, मुझे नेगेटिव बातें नहीं सोचनी है, आई विल ओनली स्पीक एंड थिंक पॉजिटिव. सो ये बहुत ही जरूरी चीज है. सम पीपल हु आर नॉट एबल टू डू दैट एंड सफर फ्रॉम सिवियर एंजाइटी इश्यूज can also go and start meditation and yoga and all those things, because that will help them to calm their minds and calm their thoughts also. So you can start meditating regularly. It will definitely have a positive impact on your results. Next is avoid caffeine or reduce it to 1 or 2 beverages per day. So this is also very common कि आजकल कॉफी कैफीन इंटेक भी बहुत कॉमन हो गया है. स्ट्रेस की वजह से या लॉन्ग वर्किंग आवर्स की वजह से हम ज्यादा चाय कॉफी पीते रहते हैं एवरी 2 hours 3 hours. So it is not good for your health. You need to reduce it to 1 or 2 cups only per day, and that will help you to improve your results. अब हम नेक्स्ट पार्ट पे आते हैं, विच इज ड्यूरिंग द साइकिल. सो जो अभी तक हमने किया है वही हमें कंटिन्यू रखना है. दैट इज ईटिंग अ हेल्दी डाइट, exercising regularly, doing meditation or yoga, and avoiding alcohol, smoking, etc. So जो सब हमने अभी तक किया है वही हमें कंटिन्यू रखना है. उसके अलावा you have to have at least 8 hours of adequate sleep. So ये जो हमारे बॉडी में जो हॉर्मोन्स होते हैं उनकी एक सर्काडियन रिदम होती है, जिसकी वजह से जब हम सोते हैं रात को तब ये हार्मोन के पीक लेवल्स आते हैं. So if you do not get an adequate sleep, you will have a hormonal disturbance or hormonal imbalance. So ये जरूरी है कि आप एक साथ at a time at least 8 hours की sleep ले. The sleep should not be broken, like पहले 2 घंटे सोया फिर बाद में 2 घंटा, ऐसा नहीं चलेगा. It should be a continuous 7 to 8 hours of sleep at night, which will have a positive impact on your hormones. Drink lots of water and fluids. This is also very, very important, that please you need to stay hydrated and you need to detoxify yourself. Have lots of lemon water when you are undergoing this IVF cycle. It helps you a lot. And try to have any kind of water and fluids that you like, but try to stay hydrated during the cycle, which will help you. As I said, you need to stop smoking and limit your alcohol intake, which continues during the cycle also. Reduce the caffeine intake to 1 or 2 cups. This also continues. Don't take any medication over the counter without consulting your fertility doctor. So this is also very important, that before the cycle or during the cycle, if you get any small illnesses like fever or cough or anything like that, please do not take any medicines without consulting your doctor, because some of these medicines do have an impact on your oocyte health. So please consult your doctor and only then you can take the medicines. Avoid foods like fish throughout the treatment, as they are high in mercury and can be harmful sometimes. So it is better that you avoid fish during this treatment cycle. Do not expose yourself or your partner to extreme heat or radiation. So ये हम सब जानते हैं कि heat and radiation, both of them have a negative impact on your fertility potential. So if you are working in any kind of environment where you are continuously exposed to heat or chemicals or radiation, then you need to stop it immediately when you are planning your baby. अब हम आते हैं पोस्ट साइकिल, हमें क्या क्या चीजें करनी है उसके बारे में। सो वंस एम्ब्रियो ट्रांसफर इज डन, हमें क्या क्या ध्यान रखना है, एंड इफ द प्रेगनेंसी इज पॉजिटिव, तो ये सब कुछ जो हम अभी तक कर रहे हैं दैट विल कंटिन्यू फॉर द नेक्स्ट 9 months ऑल्सो। सिर्फ एक पॉजिटिव रिजल्ट आना जरूरी नहीं है। द अल्टीमेट गोल इज टू गेट अ हेल्दी बेबी, अ हेल्दी लाइफ बेबी, एंड वी आर वर्किंग टूवर्ड्स दैट गोल। सो ऑल द एफर्ट्स दैट वी हैव बीन पुटिंग इट अभी तक, वो हमें सब कंटिन्यू रखना है। सो अगर हमारा एम्ब्रियो ट्रांसफर हो गया है या फिर हमारा पॉजिटिव रिजल्ट आ गया है, उसके बाद हमें क्या क्या ध्यान रखना है। सो अगेन हम हमारी डाइट पे ध्यान देंगे। सबसे पहले बाहर की चीजें नहीं खानी है। डू नॉट ईट आउटसाइड फूड, डू नॉट ईट प्रोसेस्ड फूड, बेकरी आइटम्स और आइटम्स विच आर हाई ऑन शुगर्स, and you need to have a balanced diet which is cooked at home, which includes fruits, all the seasonal fruits, green leafy vegetables, dairy products and sprouts, and you can have a handful of dry fruits in the morning. So you need to make a diet which incorporates everything, and you need to stay relaxed, keep your stress levels low. This is especially for people who have undergone embryo transfer and are now waiting for their results. It is very obvious कि उस टाइम पे हमें स्ट्रेस होगा कि मेरा रिजल्ट क्या आएगा, but you have to stay positive during that time and keep your mind to think only about positive thoughts and not think anything negative during that time or stress yourself out thinking about what will happen. So yoga, meditation and exercise can help you calm your thoughts and go through that waiting phase till you know कि आपका result क्या है. Eat fresh and home cooked food only and avoid food which is older than 12 hours. Post embryo transfer or when you are pregnant, do not lift heavy weights or strain yourself physically. So this is important, and we all know that during the early pregnancy we need to take care that we do not lift heavy weight or we strain ourselves physically or mentally. So we need to take that care, get adequate sleep, drink lots of water, stay positive, keep your mind calm, and last is that you may not be able to influence the outcome, but you can aid the process by following these do's and don'ts to make your treatment a success. So definitely it is not like कि ये 100% है, but ये सब चीजें कहीं ना कहीं help करती है to get a better outcome. So you can follow all this to get a better outcome. Foods which improve fertility. So fertility boosting foods में आते हैं eggs, walnuts, all types of berries, dairy products, beans and lentils या sprouts, वो सब आते हैं, avocado. So ये सब चीजें हैं जिनको खाने से आपका थोड़ा fertility potential boost हो सकता है. For males, eggs, tomatoes, broccoli, walnuts, low-fat dairy products, oranges, carrots, salmon, honey, corn, almonds, chicken, sweet potatoes, spinach and strawberries. ये सब चीजें हैं जो मेल पार्टनर को भी खानी चाहिए to improve their sperm health and overall to improve your health, which will ultimately affect your fertility outcome. Thank you so much. If we have any questions, then we can take that up. I'm undergoing my last cycle of IUI, after which I have been advised IVF. What can I do to increase my chances? Okay. So, since you are undergoing your last IUI cycle, first and foremost, I need to tell you that please be positive and think that you are going to get a positive result in this cycle itself. To improve your fertility potential, you can do everything that I mentioned in this session. That is, eat a healthy diet, sleep adequately, do a little bit of exercise, that is at least 30 minutes of exercise, stay positive, keep your hopes up, do not think about what will happen if this IUI is negative, do not think about that at present, just take your wholehearted chances for this last cycle of IUI, and then we may work out on what you need to do if this IUI fails. So you can do everything that I mentioned. You can focus on your diet and try to reduce caffeine and stress, which will help you in a positive way, and take your last chance with full good hopes that you are going to get pregnant. Is bed rest compulsory after embryo transfer? So this is a very common question which everybody asks us before undergoing IVF. There is a myth that IVF pregnancy में लोगों को पूरे 9 महीने सोए रहना पड़ता है बेड में. So this is completely a myth, and all patients have this query, but this is not true. So post embryo transfer, what we advise is you need to just take a little more of rest and be careful in not doing any heavy physical work or doing any stressful mental work. So you just need to take care. ऐसा नहीं है कि पूरे टाइम सोए रहना है. In fact, we advise our patients to go for small walks and something, or walk around the house or in the neighborhood or in the compound, which will help them to increase the blood supply and blood circulation in the overall body. So we advise our patients to at least roam about and move about, and do not stay constricted to your bed. And you can also do some little chores of yours which you need to do daily. It is not like that you cannot do any work. You just have to be wise in choosing that what kind of work you can do. You cannot do things which will directly put your lower abdomen under stress or increase your intra-abdominal pressure. So lifting heavy weights, etc., can lead to increase in the intra-abdominal pressure. Do not strain yourself while going to the toilet. This can also lead to an increase in the intra-abdominal pressure. So you need to take care to not do things which might strain your lower abdomen. But apart from that, you can carry on your routine life in a way that you live, and you do not need to restrict yourself to the bed. Next question. I think we don't have any more questions. So thank you so much for this, for to everyone who is listening this session. And in case you have any more doubts, then you can contact us on our helpline number, and you can know more about anything that you need to ask. And I hope this session was useful to people who are planning their fertility treatment or are planning IVF. And I hope that I have been able to solve your common queries that most patients have regarding what they need to do and what they don't need to do during this phase. And in case you have any more doubts or you need to consult us, you can contact us on our helpline number. Thank you so much.